Imagine this. You just sat down to relax, but 5 minutes later, boom, you are splitting to the bathroom again. And when you finally go, oh, it burns. Come closer. Does it sound familiar? Yes, you might have UTI. Did you know that 50% of women and 12% of men will get urinary tract infection at least once in their lifetime? But here's the scary part. If left untreated, it can turn into serious kidney infection. Oh yes, serious kidney infection. But don't worry. In a few minutes, I'm going to break down the real causes of urinary tract infection, the signs and symptoms, and the game-changing prevention tips so that you can never have to deal with this again. Let's go. Welcome to Michael's Health Update. UTI stands for urinary tract infection, which occurs when the bacteria enter the urinary system, causing infection. It can affect different parts of the urinary tract. That's the urethritis, infections in the urethra, cystitis, infection in the bladder. That's the most common infection. Pyelonephritis, infection in the kidney. That one is very serious and can lead to different complications. Let's go to the causes of UTI. The majority of UTIs are caused by bacteria, but other factors can contribute. The first one is bacterial causes, the E. coli, found in the intestines and responsible for most UTIs. Other bacteria such as the Klebsiella, pneumonia, and Proteus mirabilis. Sexually transmitted bacteria, the chlamydia and plasma, can cause UTIs in both men and women. Second one is lifestyle and hygienic factors. Wiping back to front spread bacteria from the anal region to the urethra. Not urinating after sex can allow bacteria to stay in the urinary tract. Using spermicides and diaphragms can increase bacterial growth. The third point is medical conditions that increases risks. One is diabetes. High blood sugar weakens the immune system and increases infection risks. Kidney stones. Blockage can trap bacteria, leading to infection. Catheter use. Bacteria can enter through the urinary catheter. Now let's go to the signs and symptoms of UTI, that's the urinary tract infection. Symptoms depend on which parts of the urinary tract infected. Lower UTI, that's the bladder and the urethra infection. Cystitis and urethritis. Frequent urge to urinate, burning sensation whilst urinating, cloudy, dark or strong smelling urine, pelvic pain or discomfort. The upper UTI, that's the kidney infection. Nephritis, that's the fever and chills, lower back or side pain, nausea and vomiting, fatigue or confusion. Complications of untreated UTI. If left untreated, UTI can lead to kidney infection that can cause permanent kidney damage, sepsis, a life-threatening infection in the bloodstream. Pregnancy complications can increase the risk of premature birth. Who is at risk of getting UTI? Some people are likely to get UTI, that's the women. Shorter urethra makes infections more common. Sexually active individuals. Bacteria can enter the urethra more easily. Pregnant women. Hormonal changes weaken the urinary system. Men with prostate problems. An enlarged prostate can block urine flow. People with weak immune systems. Those with diabetes, HIV, or undergoing chemotherapy. How to prevent UTI? How do you prevent UTI? Drink plenty of water. It helps flush bacteria out. Urinate frequently. Don't hold in urine for long periods. Wipe front to back. Prevent bacterial transfer. Urinate after sex. Flushes out bacteria from the urethra. Avoid irritating products. No scented soap or deodorant near the genital area. Wear loose fitting clothes. Cotton underwear helps to keep the area dry. So let's go to the diagnosis. How is UTI diagnosed? Doctors may use following tests. The urinalysis checks for white blood cells, bacteria, and blood in the urine. Urine culture, identify the specific bacteria causing the infection. Ultrasound or CT scan. If recurrent UTI occurs, imaging may be needed. Treatment for UTI. Mild UTI treatment requires antibiotics commonly prescribed, pain relievers such as the ibuprofen. Several UTI treatments, IV antibiotics if the infection spread to the kidney. Hospitalization may be required for serious kidney infection. home remedies that may help. That is the cranberry juice. Some studies suggest it may prevent bacteria from sticking to the bladder wall. Probiotics, that is yogurt, can promote good bacteria and reduce UTI risk. Vitamin C may make urine more acidic, making it harder for bacteria to strive. When to see a doctor? If symptoms last more than 2 days, if there is blood in the urine, if you have high fever, chills, nausea or back pain, if you get frequent UTIs, more than 3 per a year, then you need to see a doctor. For more health tips like this, don't forget to share, subscribe, like, and comment. Thank you.